Welcome back to Bernama. Today, as promised, we're going to be talking about stem cells. Joining me in the studio this morning is Associate Professor Dr. Chin, a consultant physician and a cardiologist at Beverly Wilshire Medical Center right here in the Federal Capital. Dr. Chin obtained his specialist qualifications from the British Royal College of Physicians, or MRCP, and this was back in 1998. He was conferred a Fellow of the National Heart Association of Malaysia for his services and contributions in the field of cardiovascular medicine in 2008. Of course, he's got an extensive CV, and if we're going to read that out, it's going to take like an hour and a half. But in the meantime, let's welcome Prof. Chin. Thank you very much for joining us, Prof. It's great to have you on a very relaxed day. A lot of people take an hour and a half to get here. I think you got here on time. Well,
Thank you, Gerard, and thank you for welcoming me to these studios today. And can I take the opportunity just to wish my Muslim friends around the country and around the world a very happy and selamat merayakan Hari Awal Muharram.
Well, with that, like I said before, we're going to be talking about stem cells today. And I'm sure you've heard of stem cells. And if you haven't heard of stem cells, I'm sure there's someone who's come up to you and said, hey, I'm selling a new set of pills. It's stem cell pills, and it's really good for whatever problems you're facing. Well, we're going to find out a little bit about that before the end of the show. But in the meantime, Prof. Chin is here to tell us what stem cell therapy is all about. So essentially, when you talk about stem cell therapy, what does it encompass?
Well, stem cells is a particular type of cell that has two characteristics. It has the ability to replicate multiple millions of copies of its identical self, and also the ability to differentiate into 2, 3, 4, 5 other cell types. So when we talk about stem cell therapy, we use it, we harness both of these qualities, the ability to keep multiplying, so that there's no need to sacrifice an animal or sacrifice a fetus or embryo, but to use whatever is available to us ethically, safely, and again harness its second characteristic, which is its ability to convert into various other different cell types, tissue types, or potentially way into the future and an entire organ by itself.
Well, before we talk about the benefits of stem cell therapy, how long has the research on stem cell or stem cell therapy been has already been out there in the market?
Well, in fact, stem cells treatment have been used worldwide around about 50, 60 years, and in Malaysia for about 27 years. Of course, in those days, Gerard, we didn't call it a stem cell treatment. We call it as bone marrow treatment or bone marrow transplant, because there wasn't the ability to go into the bone marrow and to isolate or to separate the different types of stem cells from the rest of the non-stem cells. So the entire bone marrow was transplanted. But yeah, it's a history of over half a century.
Right. So what are the benefits of stem cell therapy? I was talking about pills. Apparently now they say that you have stem cell pills which can help you with whatever problem you have in your body. Saying if you've got a weak heart, you've got diabetes, it sorts everything out. It's that one pill everyone needs, apparently, but we're going to find that out shortly. For now, what are the benefits of stem cell treatment, and how what is the procedure like?
Right. Well, stem cells benefits are still being discovered all the time. We know for a fact that, for example, hematopoietic stem cells have the ability to generate new copies of white blood cells and red blood cells. So
hematopoietic blood cells, what does that mean?
So these are stem cells which are progenitors or ancestors of white and red blood cells.
Right.
So for example, a person with leukemia and lymphoma who have very faulty white blood cells, so we may be able to, perhaps using chemotherapy, to eradicate all of these child's existing white blood cells which are already faulty or maybe have a cancerous predisposition, and then to replace it with an entire new set of white blood cells. Now, I can't transplant the entire white blood cells into the child, so I would use stem cells. And these stem cells, when transplanted into the child, after eradicating all of his own white cells, will then go into the body and start replicating and allow the child to live a normal life again. So on that concept of using stem cells for leukemia and lymphoma, a lot of us scientists are now translating that research or that potential from hematological or blood-borne diseases to non-blood-borne diseases, such as the heart, or maybe stroke, or maybe liver or kidney diseases.
Some people say, or people in their 50s and 60s say that they go for stem cell therapy, you know, to get to that fountain of youth, which they've been looking for a long time, and most of them have found it in stem cell therapy. And when they go for these therapies, apparently they feel younger and better, more rejuvenated. I don't know what that's about, but have you come across or spoken to people who've apparently been for these kind of treatments?
Yes, well, in fact, even as a lot of the earlier research will focus on very, very ill people, people who are at the end of their life, people with end-stage heart disease, people with end-stage kidney disease or liver cirrhosis, and where the research evidence have shown that even in such dire and end-stage conditions, stem cells have the ability to regenerate and to repair these organs and tissues. Therefore, bringing it a step forward, maybe the stem cells would also be able to provide daily and little repairs and maintenance of these bodies. Other research have certainly shown that the stem cells not only repair where there is not a need to repair, but they are able to influence their neighboring cells. So the donor cells can influence the resident cells through hormones and other paracrine cell-to-cell contact to actually wake up these cells and make them active again. So there is the potential to use stem cells for healthy aging, but never, Gerard, I think you and I both know, never reverse aging or anti-aging.
So
yes.
Never reverse aging.
Never reverse aging.
But I mean, if you do go for stem cell therapy,
yes,
you would feel much better after that. Saying if you're always having aches and pains, or
potentially you would. Mesenchymal stem cells, a very particular type of stem cells, which is currently the most established form. The mesenchymal stem cells have this very unique ability to reduce inflammation. Inflammation is part and parcel of our body's injury.
Right.
For example, if we have a mosquito sting, the mosquito sting is so tiny, but the inflammation that comes after that creates this big bump on our skin, that's created by our own body. So the inflammation is everywhere, on our joints, in our heart, making us feel tired and lethargic and sluggish. And mesenchymal stem cells actually is anti-inflammatory, or rather it is immunomodulatory, and it can suppress inflammation. And we now think that in fact this is why one of the main reasons why stem cells are working in patients with kidney disease and liver inflammation and heart inflammation, not because it's actually regenerating new organ tissue, but actually by its other characteristics is actually reducing the body's overactive or overreactive inflammation that causes the organ injury. So coming back to patients who are relatively well or clients who are relatively well, then there are little aches and pains and muscle aches, which are also inflammation mediated,
joint inflammation,
will also be more easily overcome.
Right, right. So for those of us who are thinking about stem cell therapy, who would want to come and see you? Or rather, you know, to put this, to make this question sound a little better, for your treatments, who would essentially, what kind of problem should I have when I want to visit you, or rather consider stem cell therapy?
Right. Well, first of all stem cells treatment is still considered developmental and under evaluation. Right. And so that must be that proviso then.
Right.
So as a result of being under the evaluation stage, not every patient is eligible to enroll in the program. There are strict inclusion and exclusion criteria. Secondly, for any particular disease, stem cells is never first-line treatment, not at this stage. Maybe not for the for many cell diseases. But in every disease.
I don't know, somehow I feel that the treatment is there, but pharmaceutical companies own the world, so that's why these treatments are being slowed down.
Being impeded, I think.
I'm a bit of a conspiracy theorist. I'm sorry about that. Yeah.
Well, the pharmaceutical companies in the Western world now, and I'm not saying that they are not right, but what I'm saying is that a lot of Western medicine at the moment looks at, and you can tell from the classes of the medications, they are inhibitors of one type, antagonists of another type, blockers of the third type. Now, we must work to repair rather than to inhibit or to block. Coming back to how we should go about doing this, stem cell should never be used or tried on itself. It must always
be
in conjunction, or rather maybe in addition to conventional therapy. So it should be done by a specialist in that particular discipline, who is then able to look at the patient and say, have you tried everything else that is currently available to you? And if you have tried everything else, and if that cure or the treatment provided is unsatisfactory, or if there's no existing cure at all, for example, multiple sclerosis or systemic sclerosis, then with the available evidence that we have, with your consent as a patient and my understanding as a physician, maybe we can try stem cell treatment. Waiting for all the results to come about may be too late for you.
Right.
So in such full information given and consent by both parties, in the face of already taking existing therapy without a satisfactory result, that's when stem cells can be used. So the examples of this would be like, for example, patients waiting for heart transplant, in heart failure waiting for heart transplant, patients waiting for kidney transplant, or before even you reach that stage, patients with multiple sclerosis, patients with stroke, or spinal cord injury. Now, I'm not saying that stem cell treatments are going to be very effective for these same patients, but in such dire states, maybe stem cells can be tried. And now, why do I quote these examples? I feel that, again, the global research have shown sufficient, consistent evidence of some benefit. Now, it's only when we keep going and we keep researching and we keep trying and improving and developing that these cures have the ability to finally provide a very, very satisfactory cure for all these patients.
Well, if you think about it, to try to make some sense or get some clarity out of this, Professor Chin rightly pointed out that stem cell research has been ongoing for a good 50 years.
Yeah.
How long did it take to develop the cholesterol medicine you're taking, let's say statins? You need to think about that. Maybe lesser than 50 years, I'm sure. And that being said, there's a lot of questions that surround it, and I'm sure people are looking for answers too. Very quickly, if one wants to get any information, do you have a website where they can read about stem cell therapy and how they get in touch with you?
Yes, they can come to my private email, or
right. No, just a website address for the Beverly Wilshire Medical Center.
Yes. This will be Beverly Wilshire Medical Center.com actually.
Yes. Beverly Wilshire, that's BEVRLY space Wilshire. .com, yeah?
Yes, that's right.
Yeah,
yes.
You get all the information there. If you can't find the information, or if you can't get to the website, just Google Beverly Wilshire Medical Center in Kuala Lumpur, and I'm sure you'll get all the relevant information. Very quickly, for those of us who are running out there and buying thousands of bottles of stem cell pills, what is your honest opinion about it, and do you think it works?
Right. Doctors have no opinions. We go by consensus. The government guidelines published in 2009 strictly states that where it is human, umbilical cord stem cells or hematopoietic stem cells, these are the most established forms. Embryonic stem cells or fetal stem cells, these are unborn babies and unborn fetuses of any species, human or animal, is strictly experimental. Animal cells or animal stem cells are currently prohibited. So while the government is encouraging a lot of stem cell research and development in this area, it is quite clear on what is currently prohibited. And again, worldwide, in majority of the countries, animal cells and animal stem cells are prohibited. And that's where these pills come from. Animal placenta, animal stem cells. So they are not legal by right. But the other thing is, but I'm not an expert on this, but the other thing is stem cells are meant to be alive, and they have their best quality when they are alive. And you can't put something that's alive in a pill, in a bottle of water, or in a fridge. Just think about our little fish and guppies that we put in our bottles. If you don't change the bottle of water, it's going to get very, very sick. So, and when these cells die, and you inject or consume these cells, potentially the effects or the side effects can be quite harmful. Yes.
Well, the side effects can be quite harmful. So if anyone, be it a general physician or anyone at all, comes up to you and says, look, I'm selling stem cell pills, you need to try this, we don't want for you to waste money or lose hundreds if not thousands of ringgit. Please go see a professional, or rather get advice of a professional. This is the real McCoy. And when you get bad information about stem cell therapy, you start to see people like this in a bad light. And people like these, or rather Prof. Chin is doing a lot of great work with regards to the research of stem cell treatment within the country. And we hope in the next 10 to 15 years we'll be able to see some top-notch treatment being done in Malaysia, if it's not already being done here. Well, Prof. Chin, it was an honor speaking to you today, and thank you for the great work you've been doing.
Thank you. Thank
right.
you, Gerard.
Once again, if you want to find out more about Prof. Chin, all you need to do is Google Beverly Wilshire Medical Center, and you'll get all the information about him. We just spoke to Associate Professor Dr. Chin, consultant physician and cardiologist at Beverly Wilshire Medical Center. Well, once again, before we close the show, I want to tell you that if should anyone come to you and say, I've got stem cell pills or some sort of stem cell treatment, be careful. Seek for the professional. If you want to Google the name, Google Associate Professor Dr. Chin, consultant physician and cardiologist. And I'm sure you'll get a lot of information for him. Get in touch with this man and ask him all the questions you'd like to ask him about stem cell treatment. On that note, thank you very much, Doc.
Thank you, Gerard.
It was a pleasure speaking to you. Stay with us right here on Bernama TV. We've got news updates coming up very soon. We'll be back tomorrow with more for you on Wednesday's edition of Bernama Today. I'm Jared Ratnam signing off.